Imagine this for a moment. You're spending a quiet evening at home, maybe settling into your favorite chair with a book or watching a show you enjoy. Everything feels normal, familiar, comfortable, and then suddenly something feels wrong. There's a heavy pressure in your chest that wasn't there before. Your breathing feels tight, and one of your arms starts to feel strangely weak or numb. You might even feel lightheaded, as if your body is sending signals you didn't expect. Many people in moments like this find themselves completely alone, unsure of what is happening and unsure of what to do next. And even though this scenario feels frightening, it's more common than most people realize. Every year, hundreds of thousands of older adults in the United States experience heart-related emergencies when nobody is nearby to help them immediately. What's surprising is that research shows something encouraging. A major study from a European heart research group found that older adults who understood what actions to take in the very first minute of symptoms had dramatically better outcomes. In fact, the improvement in survival probability was measured at over 70%. That means that knowing what to do in those early seconds, before panic takes over, before confusion sets in, can change everything. And here's another important detail. In that same research, almost 9 out of 10 people over the age of 60 admitted that they wouldn't know the correct steps to take if they suddenly began experiencing serious cardiac symptoms while alone. Many freeze, many become overwhelmed, and many unintentionally do things that make the situation worse instead of better. The mind becomes foggy, judgment becomes clouded, and without preparation, the body's natural reaction is often not the safest one. So today, my goal is simple. I want to share 7 carefully studied and widely recommended steps that may help you stay safe if you ever find yourself facing a situation like this. These aren't personal claims or dramatic statements. They're practical, evidence-supported techniques gathered from respected sources in cardiology and emergency care, the kinds of strategies many experts teach their own family members. Before we begin, I want to remind you that knowing these steps now is far more effective than trying to learn them during a stressful moment. Preparation matters. Calm understanding matters. This is information that could help you maintain clarity when you need it the most. So let's start with the first important strategy, one that might seem simple, but in reality can make a tremendous difference when every second counts. Tip number 7, build your emergency communication setup. This first step may look basic on the surface, but its importance can't be overstated. When your body is under sudden stress, your ability to think clearly can change far more quickly than most people expect. Some studies have shown that within under half a minute of a serious cardiac event beginning, a person may feel disoriented, confused, or unable to communicate normally. It doesn't mean there is anything wrong with the person's memory. It's simply the brain's reaction to receiving less oxygen than it needs. Because of this, planning your communication system in advance can be crucial. Start by making sure your address is easily visible near every phone in your home. Write it down clearly, including apartment number, gate information, or anything else that might help responders reach you. Use a large, easy-to-read card or piece of paper. In an emergency, even familiar details become surprisingly difficult to recall. You should also set up quick dialing on every phone you use. Even though dialing 3 numbers seems simple, it becomes surprisingly challenging when your hands are shaky or when your coordination is affected. One-button dialing removes that problem completely and can save precious seconds. Another essential point is keeping your phone within reach at all times. Not charging in another room, not buried under papers, not forgotten in a coat or purse across the house. Many nighttime emergencies happen when people are asleep, and reaching the phone becomes harder. Keeping it at your bedside is a small habit that can make a major difference. If you live alone, consider a medical alert device as well. These devices only help if you actually wear them, including during sleep and bathing. Many people take them off at moments when emergencies most often occur. Waterproof models are slightly more expensive, but they allow you to keep the device with you at all times, reducing the chance of being unprotected at the wrong moment. And one more thing, if you trust your neighbors, let at least one of them know that you may need help someday. You don't need to share your medical history. Just let them know that if something seems unusual, a strange noise, or if you haven't been seen when you normally would be, they can check in or respond. People in your building or neighborhood can become an additional layer of safety. Now that we've covered this foundational step, let's move to a technique that many people have heard of, but few truly understand how or when to use properly. Tip number 6, understanding the cough resuscitation method. This technique has been widely discussed and sometimes misunderstood, so it's important to talk about it clearly and responsibly. Some research has shown that in very specific circumstances, controlled coughing may help you maintain consciousness a little longer when your heart rhythm becomes irregular. The idea is that a strong cough creates pressure in the chest, helping push blood through the body for a short amount of time. But the key is this: it only applies while you're fully awake and only in certain rhythm related events, not in every type of heart emergency. If you ever feel sudden chest discomfort or unusual heart sensations but remain fully conscious, the technique goes like this. Take a deep, deliberate breath, filling your lungs as much as you can. Then follow it with a firm, deep cough, not a light cough from your throat, but a strong one coming from your diaphragm. Repeat this rhythm every couple of seconds. Breathe deeply, cough firmly. Some studies reported that people who used this method correctly stayed conscious long enough to call for help or reach medication they had already been prescribed. But it's important to remember what this technique is and what it is not. It is not a replacement for calling emergency services. It is not something that stops a serious cardiac event. And it is not safe to attempt after you start feeling faint or confused. It may buy you time only in the earliest moments and only while you are still alert. The most important part is preparation. If you decide this is a technique worth knowing, learn it now, not later. Review it calmly, practice the breathing motion when you are healthy, and make sure you understand when it may be helpful and when it should not be used. Now, before we move forward into medication-related advice, let me know when to continue. Tip number 5, the safe and effective aspirin method. Many people have heard that aspirin can be helpful during certain heart-related emergencies, but very few know how to take it in the way that experts recommend. What truly matters is not just whether you take it, but how fast your body can absorb it, and that depends on the method. Let's begin with something simple. Aspirin works by reducing how strongly your platelets stick together. When taken during a cardiac episode, it may help prevent a forming clot from getting larger. Many respected medical groups emphasize that a properly taken dose in the early stages can support better outcomes. But here's what most people don't realize. Chewing the aspirin may allow it to work noticeably faster than swallowing it whole. When you chew the tablet, you increase its surface area, and some of it begins absorbing directly through the tissues of your mouth instead of waiting for it to dissolve in your stomach. Those extra minutes can matter when your heart is under stress. If you ever find yourself needing this medication, and only if your personal doctor previously told you it's safe for you, the recommended emergency dose is generally a regular strength tablet or 4 low-dose tablets. Even if the coating tastes unpleasant, chewing helps speed up the process. Here is something many people overlook. Aspirin should be stored properly. Moisture, heat, and time can weaken its effect. It's best to keep it in its original bottle. Check expiration dates regularly, and place small bottles in locations you can easily reach: the bedside, kitchen drawer, purse, or other places where you spend time. And one more important detail: people who already take a small daily dose for preventive reasons often assume they don't need more during an emergency, but the preventive amount is usually quite small. Many cardiology groups note that an additional dose during symptoms is often recommended, but only if your doctor has told you it's appropriate for your specific case. At this point, some people worry about whether aspirin interacts with other medications. That's why it's helpful to discuss this with your doctor in advance. Knowing exactly what is safe for you removes confusion during a stressful moment. Now that we've covered aspirin, let's move on to something equally important: your body position during symptoms. Tip number 4, position your body for better stability and breathing. The way you position your body during a cardiac emergency can influence how effectively blood continues to circulate and how well you can breathe. It seems like a small detail, but it can make a meaningful difference. If you ever begin to feel strong chest pressure, shortness of breath, or similar symptoms, avoid lying flat on your back unless you're losing consciousness and have no other option. Lying flat can make breathing more difficult for some people and may reduce how efficiently blood returns to the heart. A better option is to sit in an upright or slightly reclined position, about halfway between sitting and lying down. You can lean your back against a pillow, a wall, or the headboard of your bed. Bend your knees slightly and keep your feet resting on the floor or mattress. This position can help your diaphragm work more freely and reduce the strain on your heart. Many emergency care specialists teach this as the supported sitting position. They often use it with patients who are conscious but experiencing severe chest discomfort. The angle helps your lungs expand, helps your airflow, and may reduce that panicked feeling of not being able to catch your breath. If you begin to feel dizzy, lightheaded, or as if you might faint, lower yourself to the ground carefully. Try not to collapse or fall. Use furniture or a wall for support as you gently guide yourself down. Once on the floor, it's safer to roll onto your side instead of staying on your back. This side position helps keep your airway more open and reduces the risk of choking if nausea occurs. Another simple but important step is loosening anything that restricts your breathing or circulation: tight belts, collars, scarves, or clothing around the chest. Many people don't realize that even small restrictions can make breathing feel more strained when your body is under stress. If possible, avoid overheating. It's common for people to sweat heavily during heart-related episodes, and wrapping yourself in blankets can increase discomfort. A slightly cool room or a bit of fresh air, if safe, can help your body stay more stable. With your body now positioned safely, the next step is controlling your breathing, which can profoundly influence your clarity and calmness during those intense first minutes. Tip number 3, the controlled breathing technique. When people start feeling strong chest pressure or sudden fear, their breathing often becomes rapid and shallow. That can create a loop that actually makes symptoms feel worse. Hyperventilation reduces carbon dioxide levels, which can narrow blood vessels and add to feelings of dizziness and panic. A practiced breathing method can help you stay more stable, reduce stress on your heart, and maintain clearer thinking. Here's how to do it. Inhale gently through your nose for a count of 4. Feel your belly, not your chest, expand as the air fills your lungs. Hold that breath for a slow count of 4. Then breathe out through pursed lips for a count of 6. That longer exhale is an important part of the process. It helps activate the calming part of your nervous system, slowing your heart rate and allowing your body to use oxygen more efficiently. Many people find that after just a few cycles of this breathing pattern, they feel noticeably more in control. If you want to master this technique, practice it when you're calm and healthy. A few minutes a day is enough to build familiarity. Then, if symptoms ever occur, your body will remember the rhythm more easily. You can also place one hand on your chest and one on your stomach to make sure you're using your diaphragm. The hand on your stomach should rise more than the hand on your chest. This helps ensure deeper, more effective breaths. Counting out loud can also help you stay focused. And if you're on the phone with emergency services, it gives them a clear sense of your condition and awareness. Now, after controlling your breathing, the next technique is something very few people have ever been taught, but it can save precious minutes for responders trying to reach you. Tip Gnome 2, the emergency door and access protocol. This next step is one that surprisingly few people consider, yet it is one of the most practical and life-saving actions you can take during the early moments of a cardiac emergency. When an emergency team is sent to your home, every minute matters. But here is something most people never think about. Responders cannot help you until they actually reach you, and locked doors are one of the most common reasons for delayed treatment. If you ever feel strong, unfamiliar chest pressure or other concerning symptoms, one of the very first things you should do, while you are still fully conscious and able to move, is unlock your front door. Even if you think you'll be fine, even if you suspect the symptoms will pass, even if you plan to sit down afterward. The simple act of unlocking your door can save precious minutes later. If it is safe, walk to your entrance while you still have strength and coordination. Unlock the door and leave it slightly open or unlatched so responders can reach you without delay. Many people underestimate how quickly the body can lose strength during a serious cardiac event. And once you're weak or dizzy, getting to the door may become nearly impossible. If you live in an apartment with security or a front desk, call them immediately after calling emergency services. Tell them help is on the way and ask them to meet the responders and guide them to your door. In large or multi-floor buildings, this simple step can save several minutes of searching. Another powerful way to prepare is installing a small lockbox outside your home, the kind that holds a spare key with a secure combination. Many local fire departments allow residents to register a lockbox code with them. If you ever call for help but cannot reach the door, responders can use the code to enter safely without breaking anything. Inside your home, you can also increase visibility by turning on your lights. A brightly lit house or apartment helps responders quickly identify the correct address, especially at night. During daytime, hanging something noticeable, a bright cloth or even a white towel, from your door or window can help make your location obvious. It may also help to create a small emergency information sheet and tape it to the inside of your door at eye level. This sheet can list your name, medications, allergies, and any relevant health details. During moments when communication is difficult, this information helps responders understand your background more quickly. And there's one more small tool many seniors find useful. Keep a whistle in a drawer near your bed or on your keychain. If you feel too weak to speak, a whistle can help make noise to guide responders or get a neighbor's attention. Now that we've discussed access and communication, we're ready to move to the most important technique, the one many experts consider essential to understand in advance. Tip number 1, the safe and proper use of nitroglycerin. This final technique is often the most powerful one when used correctly, but it is also the one that requires the most preparation and understanding. Many older adults are prescribed nitroglycerin for heart-related symptoms, but few know the exact steps to follow in an emergency. Nitroglycerin is a medication that relaxes and widens your blood vessels. This can reduce the strain on your heart and may help ease the pressure caused by narrowed arteries. But the key point is this: it works best when used correctly and only when your doctor has recommended it for you. If you ever feel heart-related symptoms and you have been prescribed nitroglycerin, the first step is to sit down immediately. Never take the medication while standing because it can make your blood pressure drop quickly, causing dizziness or fainting. Place one tablet under your tongue, not on top of it or in your cheek. This area allows the medication to absorb rapidly through the thin tissues under your tongue. Avoid swallowing it, let it dissolve naturally. You will likely feel a slight warm sensation or tingling. Many people describe this as a sign that the medication is beginning to work. Set a timer for 5 minutes. If your symptoms do not improve noticeably within that time, use your second tablet. Wait another 5 minutes and, if needed, take a third. But never exceed 3 tablets in a 15-minute period. Here is something many people are not told. Nitroglycerin loses strength over time when exposed to air, heat, or light. That is why it comes in a dark glass bottle. Keeping it in the original container protects its potency. It should not be stored in areas that get very warm, like cars or bathrooms. Many experts recommend replacing the bottle every several months, even if you haven't used it. Another essential detail: some medications are not safe to use together with nitroglycerin. If you take medications for certain conditions, for example, prescriptions for erectile dysfunction, you must inform your doctor so they can explain the proper timing and safety guidelines. Combining some medications may cause your blood pressure to drop too low. It can also help to keep a small card in your wallet listing all your medications. If responders arrive while you are unable to communicate clearly, this quick reference helps them make informed decisions. Finally, if you have been told by your doctor that it is safe for you to take aspirin alongside nitroglycerin during symptoms, the combination can be supportive. But again, this must be based on your doctor's guidance, not guesswork during a stressful moment. Now that we have covered all 7 techniques, let's bring everything together. Putting it all together. Your preparedness plan. These 7 steps are powerful, not because they replace emergency medical care, but because they help you stay stable until help arrives. Emergency response times vary widely across regions, typically ranging from several minutes to longer. Those early minutes are when preparation makes the biggest difference. One of the best things you can do starting today is create a small emergency routine you can practice occasionally. Review your breathing technique. Ensure your medications are within reach and stored properly. Keep communication tools accessible. Make sure your address and emergency information are visible. Check that your door can be unlocked quickly. Rehearse your steps calmly so they become second nature. Knowledge becomes most useful when you've rehearsed it before you need it. By preparing now, you reduce panic later. A final message about preparation and peace of mind. Now that we've gone through all 7 techniques, there's something important I want you to remember. These steps are not meant to make you fearful. They are meant to give you control. One of the most powerful things any of us can do, especially as we get older, is to prepare calmly for situations we hope will never happen. Preparation is not worry. Preparation is confidence. It's the quiet understanding that if something unexpected happens, you already know what to do. And here's what many older adults tell me after learning this information. Knowing these steps brings them peace. They feel more secure living alone. They feel more confident leaving the house, traveling, or simply going to bed at night. Because instead of wondering, what if something happens and I don't know what to do? They can say, I have a plan. These steps are not complicated. They don't require equipment. They don't require physical strength. They only require knowledge and a few minutes of practice. Let's quickly summarize these 7 techniques once more so they stay fresh in your mind. 1. Set up your emergency communication system. Keep everything you need visible, reachable, and easy to use, especially when your mind may not be clear. 2. Learn when controlled coughing may help. Understand it calmly now so that if you ever use it, you'll know how to do it correctly. 3. Use aspirin the right way, only if your doctor approves it for you. Chewing it may help it work faster, and storing it properly ensures effectiveness. 4. Position your body safely. Sitting upright or leaning back slightly can help you breathe better and stay conscious longer. 5. Practice controlled breathing. This can reduce stress on your heart and help you think more clearly during symptoms. 6. Make sure responders can reach you. Unlock your door early, inform building staff if needed, and consider tools like lockboxes. 7. Understand the safe use of nitroglycerin if you have been prescribed it. Use it sitting down, store it properly, and follow the timing your doctor has recommended. Taken together, these techniques create a powerful safety net. They don't replace medical care. They don't replace calling emergency services, but they help you stay stable. And that stability can make all the difference during those critical minutes before help arrives. Why sharing this matters. If you are someone over the age of 60, or if you care about someone who is, this knowledge can be incredibly important. Many older adults believe they will figure it out in the moment, but in reality, emergencies come with confusion, fear, and rapid changes in the body. What your mind can do easily right now may become much harder when your body is under sudden stress. That's why conversations like this matter. That's why practicing these steps matters. And that's why sharing this information matters. If you know a friend, parent, neighbor, or relative who lives alone, or who has risk factors such as high blood pressure, family history of heart problems, or high stress, consider sharing this video with them. You might give someone the knowledge they need long before they ever need to use it. Many heart-related emergencies happen silently, but preparation speaks loudly. A thought for you before we end. Take a moment to imagine how much calmer you'll feel knowing that you're prepared. Imagine how much more confident you'll feel going about your day, your routines, your evenings. Preparation doesn't change the future, but it changes how you face the future. Your heart, your well-being, and your peace of mind are worth the few minutes it takes to learn these steps. And the more you know, the more you can protect yourself and the people you care about. Your story could help someone else. Before we close, I'd like to invite you to share something in the comments. Have you ever been in a situation where you or someone close to you faced a heart related emergency while alone? Or is there something you wish you had known earlier in your life about handling unexpected health moments? Your experience could become the reason someone else stays calm, prepares, or reacts quickly when it matters most. Every shared story helps make this community stronger and more informed. Thank you for being here. Thank you for taking the time to learn these life saving steps. Thank you for caring about your health and for preparing yourself with knowledge that could protect you in the future. Staying informed is one of the most empowering decisions you can make. Remember, these steps are here to support you until professional help arrives. They're here to keep you steady. They're here to help you stay safe. And as always, take a moment today to check your emergency items, review your steps, and practice even the smallest parts of this routine. These tiny habits add up to real safety and real confidence. Thank you for watching and take good care of yourself.